So what we were discussing, we were discussing Okay, can you hear me, students?
Yes, ma'am.
Okay.
Yes, ma'am.
So in the last class, we were discussing about what, how to measure temperature, how to measure BP, is not it? So for measuring BP, what we need to do, first we have to ask the person to sit down. Okay, you have to ask and come down. That means his BP won't get fluctuated. It won't, say, but you need to ask them to sit down. Then after what you have to do, somebody can relax and what will happen means you have to place, this is the arm, you have to place this arm just at the level of the heart. This is the heart, and you have to place it just above the level of the heart. Understand? And you have to ask the person to sit down in this position. You have to ask the person to sit down. And after that, you have to place the cuff. This is the cuff for BP machine. This is the cuff. You have to place the cuff in upside of the brachial artery. This is the brachial artery, and you have to place the cuff here. Understand? You have to place the cuff above this brachial artery. Then you will have to means squeeze the air bulb. This is the air bulb of the sphygmomanometer. You have to squeeze this air valve. Okay, this one is this one. And with this air valve, you can control the speed of the air. You can say speed of the air. Then, this is sphygmomanometer, and with the help of this sphygmomanometer, means reading this finding, you'll be able to know. I mean, how long. Okay, means suppose if you squeeze it hardly, it will raise on and on again. This mercury. This is the mercury level which you'll find in the sphygmomanometer. Understand? And if this is the stethoscope and this is the diaphragm, okay, if you place this diaphragm in the brachial artery, this is the brachial artery, and if you place upside this, what will happen? You will be able to hear the sound. Listen, with the help of the stethoscope, you will be able to hear the sound. And if as you go on squeezing this bulb, what happens? The air, it will pump to this cuff. This is the cuff. The air will be pumped to this cuff. Then afterwards, what will happen? It will be tight. It will become tight now. And after that, you'll have to place the stethoscope. This is the diaphragm. And you have to place the stethoscope above, means upside of this brachial artery. then you'll be able to hear the sound. And the sound, what kind of sound you'll be able to hear? The first sound which you will hear is known as systolic. Okay, the first sound which you will hear is the systolic pressure, blood pressure. And the second sound, that is the last one, which you will hear is the diastolic blood pressure. Okay, is it clear, everyone?
No, ma'am.
Okay.
Yes, ma'am.
So let me explain to you again about the semester. This is the earpiece or the ear tips also you can say. This is the binaurals. This is the brace. This is the tubing. And this is chest piece. This one is the bell. This one is the diaphragm. I'll show you again here. This one earpiece or ear tips also you can say. This is the binaural. This one. This is the binaural spring. Okay, and this is the tubing. This is the tube. And this part is known as chest piece. Understand? This part is known as bell. This part is known as diaphragm. And now we will discuss about blood pressure. First, let us see about high blood pressure or else hypertension. Okay, so this is the table or hypertension, this one, how to know it. So normal is 120 by 80, that is systolic is 120, diastolic is 80. So if it is elevated, that is high blood pressure, that is stage 1, how much you will be getting systolic? From 130 to 139, you will be getting systolic. And diastolic, from where to where you will be getting 80 to 89, you will be getting the diastolic blood pressure. And in the stage 2 of hypertension, what you will get? You will get systolic as 140 and diastolic as 90. And the next or the last one is known as hypertensive crisis. So in this hypertensive crisis, what will happen? Your blood pressure, it will become very much high, too much high. Okay, that is systolic will be higher than 180 and diastolic will be higher than 120. So this is the table for high blood pressure. So hypertension, from the name itself, hyper means what? High. So obviously blood pressure will be high, it's not it. So if the blood pressure will be high, then the person will have the chances of heart disease, as well as the person can have stroke, as well as the person might lead to death also. Okay, and the blood pressure, it will be above 160 by 90 mm of Hg. Understand? And what are the symptoms which you will find in this high blood pressure or hypertension? You will find some symptoms. Symptoms like what? Dizziness, the person head will go round, the person might faint, the person might have headache. Okay. Next is blurred vision, means the person's vision won't be clear, it will be blurred. And the person will have nosebleed, from the nose blood will come out. And the person will have changed chest pain and angina, means in this area means it will pain. Understand? And next is arrhythmias. Arrhythmias means the heart rate, okay, means circulation of the heart, it won't be normal. Next is difficulty breathing. The person will find difficulty in breathing. Next is swollen abdomen, means this area, this part, it will be swollen, means it will become large in size. The stomach area, you can say. Fatigue means weakness. Next is edema, means it will puff out, it will come out, it will swell the lower extremities. Okay, is it clear? Hypertension? Yes? Okay.
Yes, ma'am.
Next is causes of hypertension, means what are the causes? Okay, because of hypertension, what can lead to hypertension? What are the causes? So first is smoking. If a person smokes too much, then the person can have hypertension. If a person is obese, means if the person is overweight, then the person can have hypertension. Next is if a person lack too much physical activity, like if the person is sleeping, only sleeping, eating. So what will happen there? The person will what? The person can have hypertension. Next is if a person have too much salt in the diet, too much amount of salt, then the person can have hypertension. Next is too much alcohol, means if a person drinks too much of alcohol, then the person can have hypertension. Next is stress. If a person takes too much stress, maybe personal problem, relationship problem, and all these things, if the person is having too much stress, then the person will be at the risk of having hypertension. Then next is old age. Huh? Huh? Old age means elderly people. Elderly people, this hypertension is mostly at the risk. And next is genetics. I already said now genetics. So what will happen in genetics means if forefathers, uncle, auntie, all those were having means grandfather, grandmother, so they can have hypertension. Means, and the next is family history. So same thing, family history also. Family history of high blood pressure is also the same thing. And next is what chronic kidney disease. If a person is having some kind of kidney disease, so at that time also the person can have hypertension. And next is adrenal and thyroid disorders. Means if a person have some adrenal or thyroid disorders, I've already explained to you in the endocrine system about this. So if a person have some adrenal or thyroid disorders, then the person can have hypertension. Then sleep apnea. Sleep apnea means sleep disorders. Means the person won't be able to sleep properly in this case. So these are the causes of hypertension. Is it clear everyone about the causes?
Yes, ma'am.
Okay. Next is symptoms of severe hypertension. Means if a person's blood pressure is too much high, so what will happen to the person? The person will have headache, and next the person will have shortness of breath. Means the person won't be able to breathe properly. Next is nosebleeds. Means from the nose blood will come out. Next is dizziness. Dizziness means what? The person's head will go round. Next is chest pain. Means this part. Okay, the chest of the person will pain. Next is visual changes. Means whatever the person is seeing. Okay, whatever the person is seeing, it will become what? It will become blur. Understand? Next is blood in the urine. Means in the urine, blood will be there. So these are the symptoms of severe hypertension. So next is risk factors of
Ma'am,
hypertension. Huh?
ma'am, visual senses means.
Visual changes means the whatever the person is seeing ना it won't be clear मतलब clear नहीं होगा मतलब blur होगा ठीक है समझ में आया क्लियर नहीं होगा जो मतलब दिखाई दे रहा है बाहर का चीज उसको अच्छे से दिखाई नहीं देगा समझ में आया समझ में आया कि नहीं हेलो
Yes, ma'am.
ओके
Yes, ma'am. Yes, ma'am.
ओके ओके नेक्स्ट इज रिस्क फैक्टर्स ऑफ हाइपरटेंशन. Risk factors means what? Means who are at the risk of having hypertension. First is age. So it depends upon the age also. If the age is if the age of the person is increasing, so what will happen? They are at the risk of having hypertension. Next is weight. If a person gains weight, okay, means if a person gains weight, he or she will become obese. Obese means overweight. So in that case also the person can have hypertension. Next is gender or else sex. So what happens in men before the age of 55, men are most likely to have hypertension compared to women. And women used to have mostly hypertension after 55 years of age. Next is lifestyle. As I've already said, lifestyle. If a person is not working at all, okay, just eating, sleeping, physical activities, not doing anything. So what will happen? The person can have hypertension. And if the person is consuming too much of salt in the diet, and if a person is having like lack of exercise, if a person drinks too much of alcohol or smoking, so what will happen? The person can have hypertension. Next is family history. I've already said this one also. Family history means if the person forefathers were having when grandmother, grandfather, all this were having, then the person can have hypertension. Okay, can anyone tell me how can we prevent hypertension? So far, I have said now about this that problem. Can anyone say how can we prevent ourselves from having hypertension? Gina, Gina Chakravarti.
Ma'am, eating a healthy food diet, getting regular exercise.
Okay, anything else?
Ma'am, not smoking,
Not smoking. Okay,
limiting alcohol,
okay,
managing stress.
okay. Yeah, managing stress. How will you manage stress? Wahida Begum, how can you manage stress? Saurabh Burman, how can you manage stress?
We can manage stress, listening to music, focusing on
Okay.
something calm or peaceful.
What? By listening some music and staying in a peaceful place. Huh?
Yes, ma'am.
Okay. And
And meditating.
meditation.
Yes, ma'am.
Okay. Okay. Can anyone tell me the symptoms of hypertension? Darshana, can you tell me the symptoms of hypertension? Darshana Kashyap, Anita, Anita,
Yes, ma'am.
can you tell me the symptoms of hypertension? What are the symptoms? If we have hypertension, what are the symptoms which you can see in a person?
Ma'am, headache, nose bleeding, blood, ma'am, blood in the urine,
Okay, blood in the
vessels
urine.
and shortness of breath, nose bleeds,
Okay,
dizziness.
okay, Okay, then can you tell me what is the instrument used for measuring BP? Deep Jyoti Haloi. Deep Jyoti Haloi, can you hear me? Dicha Deka. Dicha Deka.
Yes, ma'am.
Okay, can you tell me what is the instrument used for measuring BP?
Spigomanometer.
Sphygmomanometer. Okay. And one more else, no? One more. Sphygmomanometer and
Digital thermometer.
thermometer. From where thermometer is coming? Thermometer is used for measuring temperature, not BP. Wait, let me show you. Okay, can you see this, everyone? Can you see this screen?
Yes, ma'am.
Okay, this one. Okay, digital blood pressure monitor. So two instruments are there. That is sphygmomanometer and this digital blood pressure monitor. So this is automatic. It's digital. You'll be able to automatically see the temperature. So it's BP. First, you will see the systolic blood pressure. That is the first sound which you will hear. Next is the diastolic blood pressure. That is the last sound which you will hear. And you will see some pulse rate also. Okay, here is the cuff. You have to place the cuff above your brachial artery. Then you will find it. Okay, is it clear?
Yes, ma'am.
Is it clear, everyone, today's class? Any doubts? Any doubts, anyone? Any doubts? No, no? Okay. Okay then, thank you everyone. That's all for today's class.